Microphone. Hello, and welcome to today's session. So I'm Joan. Thank you very much for joining me. I'm Joan from Ashcroft Medical English. Now I can see that a lot of you have kind of joined the session early, and it's lovely to see your comments in the chat box there. So thank you very much for that, and thank you for joining me. I can see that for some of you, it's the first time that you've joined a session like this. So I'll make sure that, I speak to those who are maybe a little bit more familiar with the test and those who are new to it. So, introductions then. So, I'm Joan, as I mentioned. I'm a former UK doctor. I'm a premium OET preparation provider and OET All Star. And what all that means is that I've completed training that proves the quality and demonstrates the quality of the lessons that I give. I also provide regular live sessions for free on social media, and that is through this official OET channel and my own social media platforms. So hopefully you find the sessions useful, you get something out of it, because that's the point of these sessions. It's all to help you on your preparation journey. So in today's session, we will be focusing on writing, specifically how to choose the right content when you're writing your letter. So, because this is a half-hour session, this will serve as an introduction to this idea. It's likely that after the session, you'll probably have more questions to ask. You'll need to practice, obviously. And if you're needing any guidance along the way as you prepare for OET writing, or for any of the other subtests, I do offer preparation lessons, and you can find out details on that through the link in the show notes for the official YouTube channel for OET, and I also give you some links later on that you can go to if you're interested. Anyway, let's move on. I'm going to start sharing my screen just now with you, and we'll begin going through the content for today's lesson. So if you just bear with me one moment. Okay, so obviously this is the topic for today: how to choose the right content. Okay. So, what we're going to be covering today is why choosing the right content is so important. We're also going to try and define a little bit what the right content actually is. And the aim of it all is to help you feel confident in your choices in terms of letter content. And at the end, I will answer any questions that you might have. We'll try and make sure we've got time to answer a few of the things that are coming to mind. Okay. So, first things first, why is the right content so important? Well, I'm sure for those of you that are here today, your big concern right now is passing. You want to pass OET writing, and of course, this is what we're all aiming for, right? So, in terms of content, then this becomes really important, because any major errors with content are going to unfortunately lead to low scores. And what you don't want is to fail due to poor content. And the added bonus, of course, with all OET subtests, including writing, is that what you learn, the skills you develop, really do help you in real life. In terms of OET writing, it's going to really help you with your written communication that you will need to do when you're working in your chosen English speaking country. So the aim is to help you pass OET writing, and then you get the added bonus of feeling really competent and ready to perform at your best when you're communicating in the written form at work. Okay, so going back to what will be your main concern at this point in time, which is passing the exam. So, for those of you that are new to preparing for OET, something that's really important to know is that you should familiarize yourself with the assessment criteria for the test. So, when it comes to OET writing, there are 6 criteria that the assessors look at when they judge the quality of the letter that you produce. And these criteria are divided into purpose, content, conciseness and clarity, organization and layout, genre and style, and language. Now, in today's session, there won't be enough time to cover all of these. We're going to be focusing in on content. So, if you are wanting to find this document that I'm showing you on the screen, just go to OET.com and you will be able to find the official assessment criteria. Just put assessment criteria in the search box and it should come up for you. So, when you look at it, you'll see something like this, okay? And when it comes to content, you'll see that along with these other criteria here, it's marked out of 7. Purpose is marked from 0 to 3, okay? The rest be marked from 0 to 7. So content, if you are doing really well for this, your score is 7. So let's aim for that, shall we? Let's take a closer look at it and see what the criteria are telling us. Now, if you score a band 7, the top score possible, the content of your letter will be appropriate. Now, this is the key word, appropriate to the intended reader. So the reader is really important. It addresses what is needed to continue care. Key information is included and no important details are missing. The content from the case notes is accurately represented. Now, when you're thinking of content for your letter, all of these things are so important if you want to get a top score. Okay, so moving on. If you haven't had a look at a writing test before, I've got one on the screen here. This is just the first section of it. In fact, it's OET Sample Test 5, which is available for you on the official OET website if you want to have a look at it after this session. Okay, so OET Sample Test 5. Okay, so when we have a look at it, we can see here that you've got 5 minutes reading time. Okay, and please note that in that reading time, you cannot put pen to paper. You cannot highlight, you cannot write. It's purely reading time. Once that 5 minutes is over, then you can start highlighting or underlining the information that you want to include in your letter. Okay, so 5 minutes reading time, 40 minutes writing time, and you'll be given key information you need to write your letter, okay, such as the patient's details, the date of writing, what your role is in their care, social information, family history, etc., etc. So as you go on, you'll see the medical history and you'll see things about their medication, further information about presentations, and at the end, you'll see a writing task. Now, this is really important so that you know exactly who you are writing to and why. So you can see here that you'll be writing to a consultant cardiologist, and you can see the reason in here. You're needing some advice and a review of your patient's medication. So I know I've gone through all of that quite quickly, but do not worry. We are going to be focusing in on small sections of these case notes, and we're going to be analysing the content that we would like to choose when we're thinking of writing a letter to the cardiologist regarding the patient. Another thing I would like to highlight here is this. this information is really important. Now, the case notes are exactly that. They're notes. Okay, so remember, when you're writing your letter, you're going to need to make sure that you write complete sentences with the articles in the right place, prepositions in the right place. It needs to be a full sentence, and the format needs to be in the right letter format, and they give you a guide as to roughly how long the letter should be. But let's get focused in on the content. Okay, so back to content. If you want to score top marks, here are things to think about. Read the content of the case notes and think, is this information the reader wants? Does this information allow them to do what I'm asking them to do? Have I included all of the information the reader needs? And have I then accurately represented the information? So, as you write your letter, you will be wanting to paraphrase certain parts of the notes. You'll be wanting to expand them into full sentences. And you'll need to be careful as you do this to make sure that the meaning remains the same. Okay? So, here's a diagram just to sum up what I'm trying to explain here, which is that if you want great content for your letter, you're going to have all the relevant information, none of the irrelevant information, and you're going to be accurate in the way that you represent the information. So nothing's going to be missing. The reader can do their job properly based on what you give them. There won't be distracting information because it's irrelevant, for example, and your message is going to be crystal clear. So, over to you for a moment. A question for you. Okay, let's think of a scenario. You, as a healthcare professional, have received a letter from another medical colleague. You read the letter and there's information missing. What problem does this cause you? Answers in the comments. So, first think about missing information. What problems does it cause you? I'll wait a moment for you to pop some answers in the comments if you don't mind. Okay, so let's have a think about that. And now let's have a think about the next question. What if irrelevant information is put in there? So, information that you don't actually need. How are you feeling about that letter? What problems is it causing you? I can see some really good comments coming in there. So, thank you. So, yes, when we don't have the right information, yes, it can hinder making a diagnosis. Yes, it could lead to mismanagement potentially. Yes. So yeah, there are a number of things that could become quite problematic for you. So you might feel a little bit like this healthcare professional here. They might be thinking, gosh, I'm missing the most important information I need to do my job. You might be a bit confused. You might think, okay, I'm going to need to contact them and get more information. Or you just might be a little bit irritated, thinking, well, I don't know why they're telling me this. It isn't actually relevant. You get the idea, okay? So you start to get the feeling of just how important it is to make sure that you choose your information carefully. Thank you for all your comments. You've really got this concept. I'm sure that you've all been in this position, receiving a letter that maybe could be better. Okay, so let's focus in then on choosing the right content in relation to the case notes that we looked at the very beginning of the session. Okay. We're going to think of this in 3 steps. Step one, who am I writing to? We need to know who you're writing to so that you can provide them in their specific capacity as a healthcare professional the information they want to know. Okay, you're going to need to be clear on why you're writing to them. Okay, so that's all clear in the case notes too. And then it's really important to think about it from the reader's perspective and think, okay, so if I were receiving this letter, what would I want to know? Okay, so let's go to who am I writing to? We are going to get that information from the writing task section. And we can see we're writing to Dr. Banerjee, who is a consultant cardiologist. Okay, so we know who, we're thinking cardiologist. That lets us start to think, okay, what does a cardiologist want to know? What information is interesting to them when they receive a referral letter? Okay, so now why? Why am I writing? So for each letter that you write, there will be a specific reason why you're writing. There will be something that you need. Okay, and you're going to find that reason for writing in the writing task here. And in this case, you need some advice from the cardiologist and you would like a review of your patient's medication. Okay, so you can see the purpose for writing there. And also, of course, you need to be clear on what the actual problem is that you're having that you need some assistance with. And in this case, you can see information from the very beginning of the case notes. Your patient has cardiac problems. You are a GP. You've been seeing your patient for 2 years and she's been recently hospitalized. As we go through the case notes, we can see more details of this problem. We can see that she had a heart attack in February. We can see that she's also having some problems with side effects of the medication she's been put on. Okay, so we're clear on why. So now let's put ourselves in the shoes of the cardiologist and think of, okay, so if I were the cardiologist, what would I want to know? So you're a cardiologist. Your patient has cardiac problems, okay? And they've had a recent MI. So they've also got problems with medication side effects. And as a cardiologist, the GP is asking for advice and a medication review. So, in the shoes of a cardiologist, let's think about things in the case notes that would be of interest to you and very useful so that you can do your job as the cardiologist and do what has been asked to give advice and a medication review. So, simple question you can ask yourself is relevant or irrelevant? Okay, so back to the case notes. This is the beginning of the case notes I showed you earlier. Okay, so we're looking at Eleanor Bennett's case notes, this 45-year-old female patient who has recently been treated for cardiac problems. Here we can see her social background and her family history. Tell me in the comments, do you think this is relevant or irrelevant? The social background relevant? Is the family history relevant? Let me know your thoughts in the comments. Relevant or irrelevant? Let's see how your thoughts match up with what I might look at and view as relevant. Okay, so I'm getting a mix of different ideas here in terms of relevancy. Okay. So we've got a few comments saying irrelevant. And others saying relevant. Okay, so some are relevant. So we've got a mix. Okay, so this is what I would have selected if it were me going through the case notes and thinking what's relevant. So there's actually a lot here that's relevant, and there are reasons. So okay, so for example, being a lawyer, we know is a high stress job generally. Being divorced, this can also be stressful, and we can see that actually this patient is reporting extreme stress, which is very relevant. Yes, I agree, Janet, who made a comment there. Stress is very relevant in this case, and the cardiologist will want to know. We've also got some relevant things there in terms of her alcohol intake and cigarette smoking. Her BMI is a little on the high side too. And we've got some other things going on in her family history, which I believe, yes, the cardiologist would want to know this. So, right, so we've got a lot of information, right? So, what do we do with it all? There's a lot. And we need to be concise in the letter. Let's have a look here at the main body of the sample letter that comes along with this sample test. Okay, here you'll see did with the case notes and how they use this information. Okay, so they've included the information about her occupation, but they've kept it concise. They've explained in sentence form the cigarette and alcohol consumption. They've included the information about the BMI and exercise level. And we can see here how the family history is mentioned, and how the social issues and the stress that she's under have been included. All relevant background information for the cardiologist. Okay. So a lot of relevant information, important content for the cardiologist to be aware of. Okay, so next question. Relevant or irrelevant? What do you think? Opinions, please, in the comments. Do you consider this information here relevant or relevant for the cardiologist? Any thoughts? So we can see we've got medication mentioned, cardiac rehab referral mentioned, and lifestyle. So all of this. Okay, yeah, I'm seeing some wonderful, quintessential, wonderful comment. Very relevant. Yeah, exactly. So the cardiologist has to know this stuff, right? This is all really important information for them. So we're going to get all of this into the letter. Okay, and you can see how it's done. In here, we can see how we've got the medication mentioned, we've got the lifestyle changes mentioned, and also the situation with cardiac rehab mentioned. Excellent, you get the idea. Okay, moving on then. Let's think about common mistakes to avoid then, just to wrap up, okay? To be able to notice the relevant content and make sure you don't miss it when you're coming to write your letter, remember to highlight the relevant content or underline it if you're doing the paper version of the test, okay? So not highlighting and not underlining is a mistake, because what happens is you end up missing content that you want to put in your letter. Okay, so all key information should be in that letter. So we don't want to skip information, miss information that actually is going to be really helpful to the cardiologist. We need to think about the reader's needs. So, of course, it's not always going to be a cardiologist. It could be any healthcare professional. Perhaps it's a, I don't know, an occupational therapist, um, a dietitian. We need to think about whoever the reader is and write for them, pick out the content for them. We mustn't distract them with irrelevant information. We're just going to cause confusion, and the main point will not be clear if we do this. And then, as you try and write your letter, paraphrase the information, make sure that the meaning remains accurate. Okay, so any questions? So, question time. I'm just going to have a look through the comments that are there in case we've already got questions. Okay, so I have a question. Does the sample writing get 500 for the test? Okay, so the letters that you see in the sample test, they're an example of a letter that would pass. 500, I wouldn't say it would be a letter that would necessarily get 500, but it is a letter that would get a high score and would certainly pass. Okay, you'll find that when you look at the sample tests, your letter might vary slightly, and that can be okay. It can still be a letter that can score well as long as it fulfills the criteria well. So hopefully that's helped answer that question. Um, can I'm just having a read of another question here. Okay, so Janet has asked a question. Can we use capital letters in writing? No, no. So you're going to need to write so that you can show evidence that you know what should be capitalized and you know what should be lowercase. So unfortunately, no. The answer to that would be you need to use uppercase letters appropriately and lowercase appropriately. So it can't all be in capitals, I'm afraid. Okay, so I'm just having, okay, and there was another question here. Can I share the whole letter? Okay, so if you want to have a look at this letter, you can absolutely get it. What you need to do is you need to go to OET.com. You need to look at the sample letters. Now, this letter is medicine, it's for medicine, so it's OET medicine. OET medicine sample test 5. Okay, so OET medicine sample test 5. So if you go to the OET website and look for the sample test, you will find it there, and you'll also be able to have a look at the sample letter that comes along with it. Okay, so hopefully I've been able to answer some of the questions well for you. We'll need to sort of start wrapping up now. Thank you very much for some very useful questions there. So, I just wanted to let you know, just in case you are looking for a little bit of further assistance as you prepare for OET, that I do offer preparation lessons. It's really important to prepare the right way and the most efficient way. I specialize in giving one-to-one lessons. I do take group lessons on request, but the majority of my work is one-on-one. Each student is given personalized lesson plans. We focus on your individual needs, and the process of learning is really efficient in this way. So if you're wanting to find out more, you can see a link in the show notes on the official OET YouTube channel if you're watching through there just now. You can also go to my website using the link that you can see here. Okay, so if you want to try out lessons, feel free to go to the website and book a trial lesson. This is offered at a reduced price, so you can try out the lesson and see how you go. Um, Thank you so much for joining me. It's been an absolute pleasure to have you here. Thank you for all your interaction. I hope you got some useful information from today's session. If you want to get in touch with me at all, you can see my contact details here. Thank you ever so much for joining me, and I look forward to seeing you in the next session. Take care. Bye bye.